During the adjournment debate on the Supplementary Appropriation Bill, the Ministry of Health made a request to pave the procurement of nearly 100 ambulances for health facilities across the country. And according to the Health Minister, the mobility package will complement the sector in its referral errands to address such cases as maternal mortality. Details of that in this report.
The country's health sector has been facing numerous challenges despite being one of the national priorities in sectoral budget appropriation. The confrontation is reflected in the lack of basic medical facilities, including ambulances in different health facilities across regions. It is widely reported that the rate of maternal deaths is alarming, with instances of lack of access to health care at the right time. Certain communities rely on traditional means of transport in the form of donkey carts to ferry women and children to health centers in times of emergency. This leaves patients closer to death given the nature of road conditions and distances to cover before meeting a medical doctor. With 70 ambulances, Health Minister Ahmadulamin Samate noted the gravity of the health disaster will be suppressed.
These are the realities. Now, in Southern Combo here, a gentleman working in Banjul, the wife said to him she was feeling labor pains. The man said, wait for me, don't move an inch, I'm coming. Entered the traffic, 2 hours to get to the village. They tried to look for a taxi to hire. Before they go to a health facility, the woman died. So this has a direct bearing on maternal mortality reduction. It has a direct bearing on infant mortality reduction and on the survival of the citizenry of this country.
He told lawmakers in Banjul that his request for mobility is a mere amplification of the demand of the people.
The request actually has been coming from the communities and from your own honorable selves with regards to challenges that your constituents have been having in getting to health facilities. Building a health facility that looks like a hotel is one thing, but people getting to that facility is also a very important step. How do they get to those facilities without ambulances? I'm sure the honorable members, you ferry more people to the facilities than any citizen in this country with your vehicles, because when they have challenges, they run to you. We've all been doing that, women delivering in vehicles. It is a big challenge and it's not sustainable.
Lawmakers are likely to approve the call for support to the trying health sector, but not without a debate on availability of funds in government coffers. The demand by the health sector amounts to $134 million from a $1.7 billion supplementary budget request brought forward before the National Assembly by the Minister of Finance, with aim to fill gaps that could not be created by the 2021 national budget. Reporting for iAfrica News, I am Mariama Cham.